kiss is yours.
This is an NBC News special report. Here's Kate Snow.
Good day, everyone. We're coming on the air ahead of President Joe Biden's remarks on the efforts to vaccinate Americans against coronavirus. Just hours ago, the Pfizer vaccine became the first shot in the U.S. to be given full approval by the FDA. Here's the president. Let's listen.
Today, we've hit another milestone, a key milestone in our nation's fight against COVID. The Food and Drug Administration, the FDA, announced it is fully concluded. It's a thorough, independent scientific review. After a strict process, the FDA has reaffirmed its findings that the Pfizer COVID-19 vaccine is safe and effective, and the FDA has given its full and final approval. So let me say this loudly and clearly. If you're one of the millions of Americans who said that they will not get the shot until it has full and final approval of the FDA, it has now happened. The moment you've been waiting for is here. It's time for you to go get your vaccination and get it today. Today. It's an important moment in our fight against the pandemic. You know, I want to thank the Acting Commissioner, Janet Woodcock, and the entire team at the FDA for their hard work. Dr. Woodcock is a true professional. She's a career scientist who served under Republican presidents and Democratic presidents. She's ensured the team followed the science above all. They've looked at the mountains of clinical data, clinical trial data, and the safety and efficiency data, and concluded without question the vaccine was safe and effective for emergency use in December. That same thing, we've got those shots in arms at the time, 350 million in the United States and billions across the world. They kept pouring over this data. The FDA approval is the gold standard. And as I just said, now it has been granted. Those who've been waiting for full approval should go get your shot now. The vaccination is free, it's easy, it's safe, and it's effective. And it's convenient. For 90% of Americans, there's a vaccination site less than 5 miles from your home, and you can get the shot without an appointment. So please, get your shot today. There is no time to waste. The Delta variant is dangerous and spreading, causing a pandemic of the unvaccinated. That's the pandemic of the unvaccinated. And while we're starting to see initial signs that cases may be declining in a few places, nationwide cases are still rising, especially among the unvaccinated. Across the country, virtually all of the COVID-19 hospitalizations and deaths continue to be among the unvaccinated. That's worse in states where vaccination rates are overall low. But even in states where many people are vaccinated, the unvaccinated are still at risk. Let me be clear. There are cases where vaccinated people do get COVID-19, but they are far less common than unvaccinated people getting COVID-19. And most importantly, their conditions are far less severe. The overwhelming majority of people in the hospital of COVID-19, or almost all those dying from COVID-19, are not vaccinated. Not vaccinated. If you're fully vaccinated, both shots plus 2 weeks, your risk of severe illness from COVID-19 is very, very, very low. Now, I know that parents are concerned about COVID-19 cases among their children. I'll be addressing this soon with Secretary Cardona to discuss how we get our kids back to school safely. Cases among children are still rare, and severe cases among children are very, very rare. But I know that parents are thinking about their own kids. It's not as reassuring as anyone would like it to be. So let me say this as parents, to the parents. As you have the tools. You have the tools to keep your child safer, and 2 of those tools, above all, are available to you. 1, make sure that everyone around your child who can be vaccinated is vaccinated. Parents, adults, teens. 2, make sure your child is masked when they leave home. That's how we can best keep our kids safe. As I've said before, The pandemic of the unvaccinated is a tragedy that is preventable. People are dying and will die who don't have to. So please, if you haven't gotten your vaccination, if you haven't gotten vaccinated, do it now. It could save your life and the lives of those you love. Now, the good news is that people are getting vaccinated. For the past several weeks, my administration has imposed new vaccine requirements on federal workers, the armed forces, people who work in federal medical facilities, and nursing home workers. Governors, mayors, and private sector leaders have done the same. We've also encouraged new incentives. For example, in some states, you get $100 if you get vaccinated. These new requirements and incentives are accelerating vaccinations once again, giving us the hope that we can put this Delta variant behind us in the weeks ahead. There are 3 facts everyone should know about where we are in this fight against this pandemic. First, even as the Delta variant has ravaged the unvaccinated, the deaths have climbed. The death rate is still 70% lower than it was last winter. Why? Because we did such a good job vaccinating those most at risk, senior citizens. America has about 54 million senior citizens. About 50 million have gotten at least 1 shot. That's almost 92%. Secondly, overall weekly new vaccinations are up more than 56% from where they were a month ago. Last week, we saw a record of vaccinations, more than 1 million shots a day for 3 straight days. This is the first time this has happened since June. 6 million shots in the last 7 days, the highest 7-day total in over a month and a half. Remember when we were trying to get 70% of the people over 18 at least 1 shot? Well, we've not only gotten that done, we've gotten 71% of everyone aged 12 and older their first shot. And that's over 200 million Americans. And over 170 million are now fully vaccinated. Third, states that have been lagging are seeing their vaccination rates grow faster. In fact, in Alabama, Arkansas, Louisiana, and Mississippi, more people got new vaccinations in the past month than in the prior 2 months combined. The progress we're making on vaccinations now is going to produce results in the weeks ahead. The sooner you get fully vaccinated, the sooner you'll be protected. According to the experts from the Yale School of Public Health, the pace of our vaccination effort has saved over 100,000 lives and have prevented more than 450,000 hospitalizations. This is critical progress, where we need to move faster. As I mentioned before, I've imposed vaccination requirements that will reach millions of Americans. Today, I'm calling on more companies, I should say, in the private sector to step up with vaccine requirements that'll reach millions more people. If you're a business leader, a nonprofit leader, a state or local leader who has been waiting for full FDA approval to require vaccinations, I call on you now to do that. Require it. Do what I did last month. Require your employees to get vaccinated or face strict requirements. And as I said last week, vaccination requirements have been around for decades. Students, healthcare professionals, our troops are typically required to receive vaccination to prevent everything from polio to smallpox, measles, mumps, rubella. In fact, the reason most people in America don't worry about polio, smallpox, measles, mumps, and rubella today is because of vaccines. It only makes sense to require a vaccine to stop the spread of COVID-19. With today's FDA full approval, there's another good reason to get vaccinated. So, please get vaccinated now. If you go to vaccines.com, or text your zip code to 438829, 438829. You can find a number of vaccine sites near you, just minutes away, where you can get your shot without an appointment. All around the world, people want these vaccines. Here in America, they're free, convenient, and waiting for you. So please go today for yourself, for your loved ones, for your neighbors, for your country. I'll close with this. We're in the midst of a wartime effort to beat this pandemic. It's one of the biggest and most complicated challenges in our history. And it's based on an unparalleled vaccination program that is saving lives and beating this virus. It's a vaccination program that's getting us back to our loved ones and a way of life we were used to. It's happening, and it's going to keep happening. If you help, it helps our economy. It gets everything moving. It keeps us growing. Together, we've made significant progress in just 7 months. We just have to finish the job with science, facts, and confidence. Together as the United States of America. So please get vaccinated today. God bless you all, and may God protect our troops. Thank you.
President Biden speaking from the White House about vaccinations. The message was very clear there. I counted at least a half a dozen times that he said, go get the vaccine. This with the approval this morning, full FDA approval of the Pfizer vaccine. The president saying the moment you've been waiting for is here. If you had any hesitancy, if you were waiting for that full approval from the FDA, go out and get the vaccine, he said. Let me bring in NBC News White House correspondent Kelly O'Donnell. Kelly, he also cited a lot of statistics about how many people are starting to get vaccines, even in places where that wasn't always the case.
And this is a day that certainly the president has been waiting for because of the opportunity to make a pitch with a different lever. The president has talked about encouraging Americans to get the vaccine for 7 months. Today he can speak to that group that have said publicly that they do not want to have the inoculation unless it is fully approved. So this gives the president one way to break through where White House officials readily acknowledge, the president does himself, that there are many Americans who have not gotten a vaccine who may not listen to President Biden. They might be better served by what the White House likes to call trusted voices in their community, their own doctor, a minister, family members. But today, the president gets to use the weight of the FDA approval as one more way to try to convince Americans. It comes at a time when certainly so much of the focus has been on the Delta variant and on surging cases. We're back to an average of 1,000 deaths a day, numbers we had not seen for many months. So it comes at a critical time when the president's handling of COVID has been judged more harshly by some Americans in new polling, and it comes when there are a question about how many tools are left. The administration originally did not want to compel vaccinations. Now they've embraced the idea of mandates as a way to try to get the country as close to fully vaccinated as possible, knowing there are still many Americans who have rejected this outright. Kate?
And Kelly, I was going to bring up that polling. I think we can show it. This NBC News poll coming out yesterday showing a lower approval rating for the president, the lowest of his term so far. Is there an effort here to try to win the public back? I ask because this is today he spoke, yesterday he spoke before cameras, Friday he spoke before cameras, Kelly.
Well, in a time of crisis, whether it's Afghanistan or the ongoing battle against COVID, putting the president's voice in the public space is one tool they have. Certainly the numbers reflected in the polling on COVID may be more of an indication of people's concern about what the virus is doing, perhaps more than the president's own actions. He's been using many different levers of government, incentives, as well as pressure to try to get more people vaccinated. And today was that tool they have been waiting for. Moderna, another of the vaccines in the pipeline, not yet fully given that FDA approval, but it's still expected. And doctors today being clear about children, that there still is not an approval for the youngest children, those under 11 years old, to get vaccinated. So we heard the president talking about steps that are important in mitigation, especially so many children are back to school, like mask wearing, which we know has become politicized and a point of contention in many states. Kate?
Yeah. Kelly O'Donnell at the White House, thank you. We also heard the president saying that he'll be addressing education soon with Secretary Cardona, so more to come there. Joining me now, NBC News senior medical correspondent Dr. John Torres is with me. Dr. John, let's talk about this FDA decision. What factors led the agency to conclude that this vaccine, Pfizer, is ultimately safe and effective for everyone?
And Kate, when they first got the emergency use authorization, the FDA used 2 months of data for all the different vaccines to give them that temporary emergency use authorization, which would expire when the pandemic expired or ended, hopefully very soon here. But when they started doing this full approval, they actually started back in May, giving 6 months of data after their volunteers got vaccinated. Looking at the 6 months of data, it took the FDA 3 months to go through that data. They're looking at safety, they're looking at efficacy, the effectiveness, but they're also looking at the manufacturing process to make sure the quality is going there, and they're making sure that the manufacturer is going to have continued follow-up, because as President Biden said, this is a full approval, a permanent approval, not something they're going to easily rescind. And so moving forward, like we mentioned earlier, you know, there were those people that were hesitant, and President Biden more than once brought up the fact that this is a pandemic of the unvaccinated. So hopefully this approval will actually push some of them towards getting vaccinated, since that was one of the things they were waiting on, Kate.
So that's just Pfizer, though, Dr. John. What about Moderna, Johnson & Johnson, people who want to know what their future holds if they got that vaccine in the first place?
So Pfizer started their application process for this full approval back in May. Moderna started theirs in June. So if you follow that timeline, Moderna should be looking at getting their full approval if they get all the data in September timeframe. Johnson & Johnson says by the fall they'll start submitting their data. Talking to Peter Marks, who is the person at the FDA that runs this program, he said it typically takes 5 months to get through a full approval process, but they're doing an all-hands-on-deck approach right now. They're able to get this in 3 months, and hopefully the same with the follow-on vaccines, because the more of those we get full approval, the more that will be out there, and hopefully the more people will get vaccinated as well, Kate.
And that opportunity for potentially booster shots as well.
Exactly, and that's one of the things that the FDA addressed, is this does not address booster shots. This just addresses full approval for the vaccine. The booster shot, the way they're going to address that will go forward. Plus, they also mentioned this is for 16 and above, which is what Pfizer initially got their emergency use authorization, not for 12 to 15-year-olds. They're still under that emergency use authorization, and both the FDA and the American Academy of Pediatrics have come out saying, don't give this to children under the age of 12 because we are doing studies. We're not exactly sure what dosing we're going to need yet, and that's what we're trying to find out.
All right, Dr. John Torres, thank you. Let me bring in former Obama White House Health Policy Director, NBC News medical contributor, Dr. Kavita Patel. Dr. Patel, how does this designation affect those who are unvaccinated, who are on the fence? Do you think the president clearly trying to sway people, convince them that now's the time to go get that shot? Are we seeing any evidence that that might happen?
Yeah, Kate, we are, and he cited some increase in numbers, and I think we'll see even more of a bump from this full approval. I've been in contact with several patients of mine who were literally citing this lack of full approval as a reason to be concerned, and first of all, they were surprised, and they said, oh, do you think this is too fast? I said, no, it has been in fact, some have criticized it's been too slow, as you've heard, and they are willing to come and get it. They did ask. They said, is Pfizer better than the others, et cetera? And it's been nice, Kate. We've got data to show that our vaccines are holding against Delta and against hospitalizations. So now is the time to get them, and Pfizer's approval, hopefully soon with Moderna's approval, will help them start today and give options as we go forward.
All right, Dr. Patel, thanks so much for being with us. That'll wrap up our coverage right now of President Biden's remarks. We will, of course, have much more tonight on NBC Nightly News with Lester Holt. I'm Kate Snow, NBC New York.
We now join our regularly scheduled program already in progress.
3 different art forms that I